Hemodialysis introduction. Failing kidneys may reach a point when they no longer excrete water and ions at rates that maintains body of these substances, nor can they excrete waste products as fast as they are produced. An elevation of waste products as measured in the blood is called as azotemia. When waste products accumulated cause a sick feeling throughout the body called uremia. The clinical techniques used to perform the kidney's excretory functions are hemodialysis and peritoneal dialysis. Dialysis means simply to substrate substances using a permeable membrane. The two major blood chemical levels that are measured are the creatinine levels and the blood urea nitrogen, BUN, levels. As these two levels rise, they are indicators of the decreasing ability of the kidneys to cleanse the body of waste products. Usually when the creatinine clearance falls to 10 to 12 cubic centimeters/minute, the patient needs dialysis. Hemodialysis uses a special type of filter to remove excess waste products and water from the body. Dialysis uses a fluid that is placed into the patient's stomach cavity through a special plastic tube to remove excess waste products and fluid from the body. Medical procedure to remove fluid and waste product from blood and to correct electrolyte imbalance. Done using a hemodialysis machine and dialyzer, also known as artificial kidney. Hemodialysis is the diffusion of dissolved particles from one fluid compartments to another across a semi-permeable membrane. The patient's blood flow through one fluid compartment and the dialysate is in another fluid compartment. Need kidney helps removing extra water and waste materials like urea and creatinine from the body. Otherwise its accumulation would poison the body. Kidney maintain blood pH and pressure. Kidney failure prevent these basic functions to occur. So, dialysis is performed. Definition: it is the removal of solids and water from body across a semi-permeable membrane. Of dialyzer, dialysis is a treatment that filters and purify the blood using a machine, thus keeping the internal environment of body stable when kidney fails to do so. Indications for dialysis: diabetes. Creatinine clearance is 15 mg/dl. Non-diabetes serum creatinine reaches 6 mg/dl. Acidosis, pH 7 = 1, electrolyte imbalance, K plus 6.5 milliequivalent/L, GFR 10 ml/min. Overload of fluids, pulmonary edema, uremic symptoms, increased level of nitrogenous waste products, acute poisoning, acute renal failure, severe edema, chronic renal failure, hepatic coma, metabolic acidosis, hyperkalemia, transfusion reaction, postpartum renal insufficiency, cardiac tamponade fluid overload, not responding to diuretics and fluid restriction. Diabetes, glomerulonephritis, heredity, cystic and congenital renal disease, neoplasm.